Before we bring you the international headlines, let's take a look at the health sector and projections for 2026. Nigeria's health sector recorded modest gains in 2025, marked by increased policy attention, expanded primary healthcare interventions, and gradual improvements in disease surveillance and health insurance coverage. Federal government initiative focused on infrastructure upgrades, workforce training, immunization programs, and responses to public health emergencies. However, persistent challenges remained, including inadequate funding, medical brain drain, weak primary healthcare systems, poor access in rural areas, and rising out-of-pocket health care costs. Stakeholders say 2026 must prioritize sustainable financing, improved welfare for health workers, stronger public-private partnerships, digitization of health records, and expanded universal health coverage. Joining me in the studio now to break all this down and provide his projections and, I assume, solutions is Dr. Saheed Babajide, Chairman, Nigeria Medical Association, Lagos State Chapter. Thank you for joining us.
Thank you, Presenter.
Yes, it's a pleasure to have you in. So from your assessments, how would you rate the federal government's overall performance in the healthcare sector last year?
Thank you very much. I think the way I will rate federal government is below average, completely below average, in the sense that the health sector was below what should be expected in terms of remuneration to worker, in terms of financing, in terms of out-of-pocket, in terms of infrastructural development. The only way they try, probably we can give them like a 45%, is infrastructure. Power supply was nothing to write home about. Remuneration was out of it. And unfortunately, government, instead of them to improve on it, I don't think they are ready to improve for 2026. It was, let's say, I don't want to use the word failure. Let me use the mild one, fear, but below average.
And I guess that explains why in a week from now, medical workers are saying they'll be on another strike or they'll resume their suspended strike. What would you say were the most significant policy reforms or interventions? Let's try to look for something good that came out of last year. So any positives when it comes to policy or interventions within the health sector last year? What did they deliver on?
I think to be frank with the federal government, I think there's only improvement in terms of infrastructure. If you go to different hospitals, you see there are new infrastructural development, new buildings. They are buildings more, or they are constructing more buildings. At the end of the day, no equipment there. The gain is that it's more profitable venture than in terms of care. You know, health sector is more care than profitable sector. They put more on the infrastructural development with a little effect on the generality of the health sector delivery. And what I just said that they be like what Minister of Health, Professor Pate, just moving around initiating or commissioning infrastructure. That's not only about infrastructure. In health sector, you have three parameters, three variables. Those three variables to go pari passu. We have the human resources, which is the remuneration for them. We have the infrastructure, and also we have the citizen. If the citizens are not getting what they're supposed to get, why those are providing are not getting what they're supposed to get, and you are providing half of infrastructure. When you look at the three parameters, it shows that you are not delivering anything. That's what we have to look at it. You are focusing on one, you are not focusing on the two. Even the one you are focusing, you are not even delivering. At the end of the day, they have not done much.
Yeah, and I think from what you said, infrastructure is just beyond, it goes beyond just the structure.
Yes,
just putting up a building,
yes.
There's the human resources, there's the equipment, and making sure everything works. Yeah. So beyond just commissioning structures, there's a lot more to be done. Is it a funding issue? Do you think it's the funding problem? What are your thoughts around, funding of primary health care, the teaching hospitals and the tertiary facilities? Are they effectively funded and also utilized?
You see, when you talk about funding, it's unfortunate that number one, there's a poor funding mentality of health in this country, from the federal to the state and to the local government. Some states are trying. And you know that there's the Abuja Declaration of 2011, which says that the 15% should go to health of any budget allocation. And you know that federal government have even not got into 7%, talk less of this. It shows that even when you talk about average of 15, what's the average of 15? It's 7.5. Government have not even got into average of 15. That shows that they don't have, their priority about it is zero. The only what priority is about security, which is good, it's about security and doing roads and doing any profitable. They know that education and net are not profitable. That's why you don't see them. They only go into profitable. Now, in terms of primary health care, is the worst I can say. That's the truth. At both federal, at both state level, primary health care is the worst in this country. People don't say emphasis on primary health care. The only one state with fair emphasis on is on the secondary health care. Why the government, federal government, fair emphasis on tertiary? How are they even delivering it? And any system which does not take the primary health care as priority is a failure system. In the same way, I'm saying that you cannot build something on a poor foundation. The foundation of any health care delivery, any health system, is the primary health care. If the primary health care is being taken care of, little will go to the secondary, that's general hospital. Little will go to the tertiary. The primary health care should take care of malaria, all those basic disease. Why, when you are going to the general hospital or the secondary health care, you go for higher something, like surgery or something like that. When you are going to teaching hospital, you go for something, so specialization. Let me talk about orthopedics now. Primary health care, they should be able to split. Go to the secondary health care, you can do surgery of the. When you now go to tertiary, talk about subdivision orthopedics, arthroplasty, any other thing. Those are the things government should be thinking. You don't just see malaria treatment, cough treatment in a tertiary or secondary hospital. Government should focus more on the primary health care. Even not only the government, not only the federal government, all the states should focus more on the primary health care. And again, to be frank and sincere with ourselves, primary health care is not the moral responsibility of the federal government. That's the truth. They're just doing what they're supposed not to do. Primary care should be left at the level of the state and local government to do the right thing. Why I talk about funding, the president, Bola Ahmed Tinubu, said that there's more money in the country. That's why he said that even Trump can be doing anything, but they have money. But the money, to be frank, money is going down to the ministry, going down to the state. What are they doing with the money? Even if the money they have, even the percentage is, let's say 6% or 5%, the money they are giving them to the ministry, to the hospitals, to the MD, the CMD, to the agency, what are they doing with it? Are they even using the one they are being given? You see, if both government and the management of health, they are all failed.
I mean, that's a lot to take in, and the responsibility of not just the federal, but the subnationals as well. Their role, providing these essential social amenities, especially if you're going about this massive tax reform, definitely needs to hold them accountable. We know one other issue that the sector has been plagued with is the brain drain, the number of personnel, the ratio to that with the patients as well. Is there any progress? There have been several attempts, even an attempt to come up with a particular law to keep, our talents in the country. So what's the progress? What progress has been made when it comes to addressing the medical brain drain? And are there any retention incentives for doctors? Are they effective?
You see, I always say, the federal, the state government, they don't have any solution. It's not their priority. That's the fact. Especially the Minister of Health. Unfortunately, the Minister is just moving around about data collection, about research. He's not interested at the federal, the government, the president, the governor. They're not interested in the brain drain. Because they are not going to this hospital. They are not assessing the government hospital in Nigeria. It's obvious. Even you hear that our president, the former president, the president get health care outside the country. What do you think that person will be care? The governor, even the local government chairman, they go outside the country. Therefore, what concerns them about Japa? Therefore, they don't have any priority about it at all. And when you don't have priority about it, when you don't think about it, what do you expect? they will not think of the solution to it. What they be thinking is draconian law. It can never work. You cannot, everybody have the right. You cannot tell me I should not move. I have the right to move. If you tell me that, I will take you to court. You cannot tell somebody not to move. You can use any law. I'm telling the government, they can use any law. Let me tell you the truth is that those in the medical school, as I'm talking now, they are even not graduated. They are thinking of JAPA. They are doing PLAP. They are thinking of JAPA. And who are the people that are going to lose? Government is losing. The parents are losing. You cannot have your children, train them. Government also train them. At the end of the day, they move out of the country. Who is losing? Now that's why Nigeria become the second exporter of doctor in the world after India. Even India going home. Later you become the first exporter of medical personnel. For me, government is not ready. Government is not giving anything. They are not even incentives at all. I can tell you even the worst part of it is that those that finished almost 10 years ago, they cannot rent a decent house. Talk less of getting car. When you see doctor, when you see them, one commercial vehicle to other, taking truck, taking your car, they're taking all this. What's the sense of going to medical school?
To get deeper into this after the break. Solutions. I think we know the problems. What are the solutions, especially with the impending strike, total strike from resident doctors next week? We'll get into it after the break here on Business Edge. Nigeria's health sector in the year 2026, what can we anticipate? We have Dr. Saheed Babajide, the chairman, Nigeria Medical Association, Lagos State Chapter, in the studio with us. Thank you for your time. And speaking of what to anticipate, we already know what is to come, a strike. Break that down for us. We know that they called off a strike sometime in November, and they're resuming that, and this time a total strike as of the 12th of January. What are their demands, and what happened to the negotiations between November and now?
Thank you very much. Unfortunately, that we have governments that are the same, from military to this essence. They are the same, all of them. They don't learn from the history. And unfortunately, is that the strike, I always tell people that workers are not strike monger. The people that only make people to go on strike is the government. If there is a law in this country that any minister or any commissioner that allows strike to strike action during his tenure should be removed, they will take action. Because before strike, somebody will give you 21 days. You don't wait for 2 or a day to that strike action. That shows that you are irresponsible. That is normal. But for this NAS strike that is coming, NAS suspended the strike because of their demand. And the people talk to them, enemy talk to them, and everybody. And the government also agree. Even the worst part of it, let Nigeria know this. Worst part of it is that the Minister of Health and Social Services, Professor Pate, refused to see the leader chief and call them different names. Unexpected of a minister. Even you have issue with, these are the forces, these are the people that take the air delivery more than any other sector, because they are the one on ground most of the time. How can you say that they are not doing anything? Even minister came out and said the hospital is working when NAD was on strike. Which hospital is working? You should show us the hospital that were working at that time. He should try to tell the truth to the Mr. President of the Nigeria. Now this strike can stop. This strike can be prevented by only one person, is the minister and the president. Because it's the ego problem of minister that creating this type of strike that go. And what they demanded for is a simple thing. The agreement they had to the enemy, that this CBA we call agreement, and till now, that CBA will be suspended till now. No movement. Therefore, you should expect them to be sitting down. Allowances they ask for, this government agree that it shall not be implemented. And now that be saying it, that these agreements, nothing has come out. They are not, even after they are suspended the strike, there are nothing tangible, positive coming from the Ministry of Health, headed by the Minister of Health. And if not go on strike, the blame should go to the Minister of Health party and the President of this country. It's unfortunate. Because another death, another avoidable death, it's unfair. You have to be careful. Anybody that dies, leadership is about taking responsibility. If leaders from the president down cannot accountable to us, but they be accountable to Almighty God. If anybody die from this strike, it's on their head.
I mean, protection of lives and property is their mandate. So, I mean, healthcare, very important. You've highlighted the focus on profitability within the health sector as opposed to service delivery. We're seeing healthcare inflation, even within the hospitals, rising operational costs affecting hospitals and patients. We saw that happen last year. Many cannot afford healthcare or even health insurance. What would you say are the solutions?
Yeah, thank you very much. The solution to this is out of pocket. That is the solution in terms of health system. The inflation rate of this country, the inflation cost rate, the food inflation rate, when you put the HCF everything together, it also affects health. The drug is high, very high, because they are being in dollars. Now, the infrastructure, the equipment is also high. Go to different hospitals now, private and public, almost every quarterly, that increase in the cost of health care. In the corresponding to the poverty level, increased poverty level of the populace. The drug is expensive, everything is expensive. How will they do it? The only solution is what? Insurance. How do they do it? Unfortunately, government is not doing it. How many people are even doing it? How many percentage are even doing it? The government concentrate only those they can collect the money from. That's the civil servant and few formal sector. Government should do now concentrate on the formal sector. Also concentrate on the informal sector. The informal sector are the market women. Are they having it? When you concentrate on them, with a very minimal premium they are going to pay, they will get this access. And when you now get this access, the meaning of insurance is for you to get accessible, affordable, and qualitative health care, which can be get at any point in time. And the government should also do with the insurance, collaborate with the private sector. How many primary health care do we have? Even look at Lagos State, we have about 300 primary health care in the population of Lagos State. Within how many wards, how many primary health care do you have within the ward? Therefore, what they should do, where you don't have such thing, collaborate with the hospital around that site and have what I call health insurance, in which they will be able to compensate for the little government cannot be able to do. The government should move at this 2026, try to increase the insurance out of pocket through insurance, going to the informal sector, because those are the major things. Go to the informal sector and also liaise with the formal sector and make sure that people are paying out of pocket. And again, government should also look at tariff, reduce tariff on drugs, especially cancer drug and other drugs, diabetic drug, and also the reduce tariff on equipment, medical equipment.
Yeah, I mean, so much that needs to be done that will enable the growth of the sector, especially in the year 2026. Thank you so much for your recommendations and the insight of what's happening within the sector. Dr. Saheed Babajide, Chairman, Nigeria Medical Association, Lagos State Chapter.